Fentanyl crisis here in Texas is something we should all be aware of at this point, and despite its deadly impacts on Texans, there is some hope on the horizon. Tyler Dupnick is here with us tonight. Tyler, what are some of the positives coming from this?
Well, Alex, one positive is that a fentanyl vaccine could be on the way soon. The University of Houston has developed the medicine that could save thousands of lives, and it is close to starting clinical trials in humans.
We feel that this, in combination with present treatments, will be a game changer.
Texas Governor Greg Abbott toured the fentanyl vaccine lab at the University of Houston earlier today and met with the research team that believes their vaccine will be a game changer to combat the fentanyl crisis. In a press conference Thursday, the study's lead author, Dr. Colin Hill, spoke about the vaccine and how it works to save lives.
You get our vaccine, you develop antibodies against fentanyl. These antibodies bind to fentanyl if it is consumed and prevent it from getting into the brain, where it may trigger euphoric centers or trigger respiratory depression and opioid overdose death.
The vaccine would be available upon prescription to someone who needs it, and it will likely most help those who struggle with opioid use disorder, law enforcement personnel who may be exposed to fentanyl during the seizure of it, as well as potentially animals like drug-sniffing dogs.
It's intended, as the doctor was explaining, it's intended to be an assistive aid to those who may be addicts to help them reduce their addiction. And it's intended to be a protective device to people who are not addicts who may be otherwise exposed to it.
Governor Abbott also recognized the University of Houston for being an international leader for a problem that really affects all of us.
Well, once again, I want to thank the University of Houston, its leadership, and their researchers for doing their part from the scientific perspective to come up with an innovative development of a vaccine for fentanyl that truly will save lives.
The vaccine is still going through the process of getting approved, but Dr. Hill is confident that it will be available at some point, despite the exact timeline unknown right now. If you recall, Governor Abbott was here in Midland back in September with state and local officials to address the fentanyl crisis, and this vaccine looks to be a step in the right direction in the fight to save lives. Alex?